Yes. Good evening, guys. So we are on the second part of developmental delay chapter. So till now we have learnt about what normal development is, how all the milestones will develop, and what are the principles of development. After that, okay, so we have learnt about the principles of development, how development happens, all the milestones, and then last class we have dealt in detail about what is developmental delay, how do we approach a developmental delay. Like we started with how to take appropriate history. In history, the antenatal factors, the natal factors, and the postnatal factors. And then we came to the examination part where we did a detailed examination, including a detailed head to toe as well as a neurological examination. And then when such case comes to us, we learned about something called a screening test and diagnostic test. So how do we do screening? The most commonly used screening tool is Trivandrum Developmental Screening Chart, which is very handy, can be used by anyone. Okay, so in this developmental tool, we also learned about how to use it, correct? So after that, I just told you that you have to just know the names of definitive test. You may not need the details of the developmental test, but you should remember the names of definitive test like Bailey scale, that is then the Darcy scale, that is developmental assessment scale for Indian infants, and then Wechsler intelligence scale, then Mullin intelligence scale. So at least these names you should be writing in your exams. Then we just went about in detail about the approach to developmental delay, and then we had come till the treatment. So treatment, depending on our evaluation, if we find any treatable cause, say some inborn error of metabolism, so we treat the underlying cause. Whatsoever the damage which is already done may not be able to be corrected completely. That is why we do something called as multidisciplinary team approach, where we refer the child to child developmental unit or district early intervention center. Now, what happens in district early intervention center here, which is present in each district? There is something called as early stimulation based on the property of neuroplasticity of brain. So that means if there is an insult to one part of the brain, if that child undergoes early stimulation, then if there is one part of the brain which is damaged, the adjacent part of the brain can be well stimulated so that it takes over the function of the damaged part. And the child's skill, whether it is survival skills or activities of daily living, can be considerably improved. So this is the concept of the neuroplasticity based on which our early stimulation and DIC works. Now, at this point of time, one question for you guys is, when do you refer to a child developmental unit or DIC? What is the referral criteria? For knowing the referral criteria, you should know something called as red flag signs. So when you see a child, there are few signs which if present, you have to directly refer the child to a pediatrician or a child developmental unit. So this is what we'll be discussing in today's class. So what are the red flag signs? As the word says, red flag, the moment you see these signs, the child needs to be referred and completely evaluated for the developmental delay. So if you go through the TAI card or the mother child protection card, which is there with every mother, all of this is printed in that card for the sake of awareness in parents. So at the age of 3 months, what are all the red flag signs? So the first red flag sign is no social smile, which is generally achieved by 2 months. So plus 1 month if we give, even by 3 months, if the child is not smiling back to the mother or doesn't give any eye contact and there's a visible squint. So at birth, sometimes we see squinting, but we do not treat it there. We wait for at least 2 months for the squinting to improve on its own, because most of the time it is apparent squint, not the true squinting. So if there is a true squint, there is no eye contact, and if there is no social smile, this plus if there is no startling reflex or any response to sound. So we also know that by 3 months, the child can even track the source of the sound by almost 180 degrees. It can turn towards the site of sound. So if that is not there, then it is a red flag sign. So social smile, eye contact has a lot to do with the vision. Okay. And this is regarding the hearing. And in the motor milestones, if the child has hypertonia, that is, if the child has retrocolis, where the head gets pushed back and the arm and legs are very stiff, because of which there is curving back of the child. This is your gross motor milestone which is affected. And if there is persistent fisting, so if you see few babies keep their thumb inside the palm, so this is called as fisting, which usually disappears with the disappearance of palmar reflex, that is around 2 months. So we can wait up to 2 months for the fisting, beyond which it will become a red flag sign. So these all are shown in our mother and child protection card. See, you can see there is no social smile, child doesn't respond to any sound, there is persistent squinting, it does not turn towards the site of the sound, there is retrocolis, you can see the child has arched back, and there is a persistent fisting. So if any of this is there at 3 months of age, then it's a criteria for referral. So this is the red flag at 3 months. Next, you should know few red flags at 6 months. So at 6 months, what all do you expect? You expect a head control and rolling over also to happen. So if there is no head control, and at 6 months, generally a child will be able to sit with support, that is tripod position. If that also doesn't happen, it cannot sit even with help. Even if when the parents want the child to sit, if there is a rounded back and the head completely drops down, child is unable to sit, then it is a red flag. So at 6 months, the child also will have a bidextrous approach. In fact, unidextrous and transfer of objects starts at 6 months. So if that is also not achieved, does not grasp things within reach, child has no interest to reach for the objects, probably talking about the gross motor, that is the muscle tone of the child. So that is also a red flag sign. If child has no vocalization, so we all know that cooing starts at 3 months. By 4 months, child laughs, that is ha ha. And then babbling starts at 6 months. So if there is no cooing or laughing also, there is absolutely no vocalization at 6 months, then it is a red flag sign. And if head and eyes do not track objects, so at like I already told you, during our developmental assessment, we had a red ring or a red bangle tied to the string or a thread. So when we move that red bangle, generally child will move to the track towards that object because it is a bright object. So if this doesn't happen, even at home, mother keeps complaining that child is just still, he doesn't turn towards any objects. So he's not turning towards any object. This is a red flag sign. And at 6 months, rolling over should start on. So when you put a child on tummy, at 6 months, child will start bearing weight only on the elbows and in fact only on the palm. So the child will lift his head. If this doesn't happen, then also it is a red flag sign. So just to summarize, you can see the pictures. There is no head control. Child is unable to sit, is not interested to reach any objects. Here does not localize. Even if mother is trying to talk to the child cannot vocalize. And it doesn't track the bright object in front of it. And in a prone position or in a tummy time position, child is unable to lift the head. So all these are red flag signs at 6 months of age. Then coming to 9th month. So 3, 6, 9, 12, you have to know the red flag signs. So at 9 months, if the child is unable to roll over or sit with support, so you can see child is just lying down. It is not able to roll over. And it takes support to sit, not its own tripod position or the own support. It needs support of the person, caregiver. Otherwise, the child will just fall on that side. That is a red flag sign. And if at 9 months, it does not sound, out of sight sound, it doesn't localize, then it is a red flag sign. And if the child is unable to utter any words like papa, mama, any bisyllables, if it is lacking, then it is a red flag sign. And if the child only tilts head to one side, that is, you can see there is torticollis like position, there's only tilting. On the other side, child doesn't turn, so then it is a red flag sign. So the red flag that is does not turn towards the sound has been put to 6 months, because we have known that hearing evaluation or the hearing impairment should be corrected at the earliest. So now the new guidelines are the hearing problem should be diagnosed at birth. By 1 month should be completely screened. By 3 months should be treated. That is why we are emphasizing more on the hearing evaluation also at birth. So if there is no startling also, it is kept at 3 months so that it is diagnosed as early as possible. So these are the red flag signs at 9th month. You can see child doesn't roll over, doesn't sit with support, and does not turn towards the sound, has a torticollis or tilting of the head. Okay, then does not utter even bisyllables. So these are the red flag signs at 9 months of age. Next, coming to 12th month. So by 1 year, generally child is standing with support, may walk by 15 months. Then at 12 months, child will start showing the objects. It will start showing pointing also. And at 9 months, our mature pincer grasp was coming. Plus at 12 months, child knows its name. He responds to his name. So he turns when his name is called out. So if all these are absent, that is, does not stretch hands to be picked up. So child is not interested in play. He doesn't show his arm and tell to pick up. So that is a red flag sign. Then he does not pick small objects, meaning that your fine motor, that is pincer grasp, has not been achieved. Then does not respond to own name. Now, does not respond to own name is a very important red flag at 12 months, because this can be your earliest sign of autism. So no response to name can be an earliest sign of autism, meaning the child is so involved in his own play, self-play, that he is not responding to his own name. So there is a very important red flag sign that you all have to remember. And the child is not interested in cooperative play. See, if you hide a toy in front of the child generally gets excited and goes and searches that place to look for the toy. If this behavior is absent in the child, that means child has some problem with social communication. So this is also another red flag sign that should be picked up. And by 9 months, we know the child has peekaboo game. So you close the eyes and then you open it, the child squeals with joy, meaning when the hand was put across or when an object was hidden, child knew that the object still existed there. So this concept is called as object permanence, which comes by 9 months. Object permanence means even if the object is not in front of the eyes, it still continues to exist. So this comes in a child by 9 months. So that is why the concept of peekaboo game from 9 months onwards. So by 12 months also, if the child is not understanding the object permanence or is not able to play a social game like peekaboo, then it is definitely a red flag sign. Again, has lot to do with the early autism signs in within 1 year of life. Okay, so next is at 18 months. So by 18 months, the child should be able to walk and even run. So but if it is not able to stand, then it becomes a red flag sign. So not able to stand, you can see there is almost crossing here, there is scissoring, saying that there is probably some hypertonia. So if that is there, if the child is not able to stand, and if he is not able to put small objects in a container, for which you need a hand coordination, the child should grasp the object, then put it in the container. So meaning along with the mature pincer grasp, there should be some amount of coordination, that is cognition, that is required to pick it and drop it in the containers. This requires a good cognition also. So if that is lacking, then it is a red flag sign. So does not use both hands equally, meaning what, the child has started using one hand predominantly, which is called as handedness. Now we all know that handedness, like for example, I'm a right-handed person or someone is a left-handed person. If this handedness comes before 2 years, then it is definitely abnormal. Okay, so then it's definitely abnormal. So generally by 2 years, and sometimes you even can relax this up to 3 years, is called as normal. But if any child is using one hand predominantly by 18 months of age, that means the opposite side is probably weak. Probably you are dealing with a child with hemiplegia. So that is what it tells. Okay, so this is your does not use both hands equally being a red flag sign at 18 months of age. Does not point finger at an object when named. So I told you pointing comes by 12 months. Child will be able to point by 12 months, but if the child fails to point by showing the object, for example, you tell where is Ajja or where is the toy, where is the clock. If the child is unable to show that when an object is named, that is at 18 months. So then that also becomes a red flag sign. That means it doesn't understand. Probably there is a lot of issues with the cognition of the child, which is impaired. Okay, does not respond to mother's gestures and seems to be in his own words. So generally by 12 months, the child comes when called, and child will know everything that the mother is doing. Maybe even at 18 months, the domestic mimicry starts. That means the child will be doing everything that the mother does. So if nothing of this is happening, and if the child is lost in his own world, so this is again probably a early sign of autism again. So generally autistic kids, they'll be in their own world. They'll be having a particular play like stacking the object in line. You give them toys, they'll just keep it in line. Or if you give them a rotating object like wheel or a fan, so they are very much interested in a rotating object. So such kind of play wherein they are not interacting with their social environment but are lost in their own world is seen by 18 months of age and does not say a single word. So by we know that at 12 months the child should be knowing 1 to 2 words, and by 2 years the child should know a sentence of 2 words like give me, come here, give milk. Such kind of 2-word sentences the child should be able to form normally. But at 18 months, if the child is not knowing even a single word, then it is definitely a red flag and requires referral for evaluation. Okay, so these are the, so this is what it is shown again. So it doesn't know any word, does not use both hands equally. So you're using one hand predominantly and does not respond to mother's play, not able to stand, is not having coordination to put small objects into the container, and he doesn't point finger to an object when named. So all of this is actually present in our PI card, which is barely used by parents properly. So if next time you go to your clinical posting, you make sure you just glance through all the pages of Thai card. Lot of knowledge is hidden in that book. So next red flag sign is at 24 months. So basically red flag means these signs will help in early pickup and early treatment, because of which we can take the advantage of neuroplasticity and give maximum benefit to the child. Okay. So at 24 months, if the child is not able to walk steady while pulling a toy. So pulling game starts by almost 18 months, and pushing game starts a little later by 2.5 months, 2.5 years. The child will be pushing cards, whereas pulling comes early because it is very easy. They just try a thread and let the toy being pulled. So if the child is unable to walk while pulling the toy, that means the child also has difficulty in coordination. Okay. And if the child doesn't scribble by 2 years, so we knew scribbling starts by 1.5 years. That is 1.5 we scribbled. So at 1.5 years, the child will know scribbling, and 2 years, the child will be knowing horizontal strokes. Correct. And by 3 years, the child was knowing a circle. So if scribbling doesn't come by 2 years also, then it is a red flag sign. He doesn't use 2-word phrases such as give milk, come here, all those things, then it is a red flag sign. He does not respond to gestures like bye-bye, which is generally achieved by 9th month. So if that is also not come, then it is a red flag sign. And by 2 years, the child should know 2 body parts. For example, eyes, ears. So at least two body parts be known by 2 years of age. If this doesn't happen, then it is a red flag sign. If he does not seem to understand and follow simple instruction, go get the water, come here, such kind of simple instruction, by 24 months, there is a lot of non-verbal communication present in the child. That means child need not speak. Child understand whatever is spoken to and does all the work. So that is reached by, that is the non-verbal communication is very strong by 1.5 to 2 years. So if this is not there, then it becomes a red flag sign. Next, coming to 36 months. Okay, that is 3 years. So by 3 years, if the child is not able to climb upstairs, so we know this happens at 15 months. So if this is not there, that means there is gross problem in the gross motor, and we are probably dealing with some muscle issue. Okay, and he cannot feed the self. So feeding self comes by 15 to 18 months by spillage. By 2 years, child will be able to feed himself without spillage. Okay, if this is also not achieved, and if there is continuous drooling and unclear speech, meaning child is unable to swallow and even use tongue and articulation problems, meaning that last 4 cranial nerves are the problem. So probably we are dealing with a child with pseudobulbar palsy, which means there is cranial that means there is an insult to upper motor neurons, because of which there is pseudobulbar palsy. So excessive drooling beyond 1 year of age needs evaluation. So here in the national guidelines, they've kept it at 3 years, but generally excessive drooling starts around 6 months because the teething starts, the child is still learning to swallow the hard objects. So we wait for a maximum of 15 to 16 months, beyond which we do evaluate excessive drooling cases. Okay. And if he is not able to communicate meaningfully and frequently repeats other speech, that means the child's vocation, the child's articulation is still not developed. He just does repeating, which is also called as echolalia. That whatever you talk, he talks. So he's like a parrot. He just repeats the same words without comprehension, without understanding that. That means there is problem with the cognition, plus this problem with your articulation. That means you are dealing with something higher motor neurons. So it is more problematic and not a localized thing like in a grossly muscular issues. Okay. So he cannot speak simple sentences like "Mummy, give milk." So all of this is given in our pictorial representation. So these are the red flag signs when the child has to be referred to a child developmental unit. We'll come back to these questions later. So at the end of the developmental delay approach, you all should know the developmental milestone list. Hearing and vision is also a domain which shouldn't be missed. It's not just gross motor, fine motor, and language and social skills. Hearing and vision is also an inseparable part of the domain. So it has to be evaluated. Okay, so because today we had only red flag signs, I've also included autism today in our. Any doubts, guys? Okay. So we'll just run through autism also today, because autism is one of the commonly asked questions, especially in Vivas, and it is not a direct, it's not a clear-cut case always. So what is autism? What is autism spectrum disorder? So autism is such a wide presentation. There are different presentations of autism, because of which we have given the word called autism spectrum disorders. That means it is not just one complaint and yes, you tell that it is autism. There is a separate spectrum. Child can range from mild autism to a severe autistic features. So that is why we have changed from autism to autism spectrum disorders, which was previously called as pervasive developmental disorders. Now, what is the main problem in autism? You remember it as 2S. One is social communication and interaction. So the child is unable to communicate with his peer group and probably even his parents and family. And social behavior, he doesn't know how to behave in which environment. Plus the second S is stereotypy. That means the child has repetitive behaviors, some repetitive abnormal movements the child has, which is more specifically defined as restricted repetitive patterns of activities and behaviors. For example, flipping of the hand, or doing the same kind of movements, so rolling, continuous rolling, just using the same kind of a gestures round the clock. Or interest, like I told, they are very much interested in rotating objects. So they are always staring at the fan or using the same toy which has a rotating wheel. So these kind of repetitive restricted interests they have. So 2S, simple to remember: social communication and behavior. Problem in stereotypy, that is stereotype movements and behavior is commonly seen in this autism. So what is the prevalence? It's very common than expected, more common in boys. 1 in 100 you can remember, and boys have almost 3 times more prevalence than females. Now, what is the cause? Why this has increased? Nobody knows. So that is when we use the word multifactorial. So in multifactorial, you should remember genetic and acquired. Now in genetic, it can be some syndromes like Fragile X syndrome, Rett syndrome, Prader-Willi syndrome, Angelman syndrome, these. Plus, there are some IEMs where it is commonly seen, like phenylketonuria. Okay, these are the genetic causes which may be related to the causation, which is still not proven. So these syndromes have higher incidence of autism spectrum disorders. So what are the acquired ones? Okay, now the acquired ones are what we have created for the child. So a poor social environment where child was exposed to very high time of screen time, sorry, not screening, the screen time. If the child exposed to a very high screen time and very early in life. So screen time has been associated with autism, has not been taken as a causating factor. That means if child has one risk factor and then you give screen time for that child, probably the chances of triggering or chances of worsening of autism is very high. But yes, in the etiology, you can still write that acquired causes like poor social environment and screen time have been associated with the autism spectrum disorders. Now, what all these do? Ultimately, what is the end result of all these causes? There is problem in the synapses formation. So, synapses white matter formation is what is hampered. That means myelination is the main problem, plus the rarefaction of the synapses. So as we age, the number of synapses increase. So this doesn't happen in autistic kids. That is why they present with those complaints to us. Okay. So how do a child present? So general average age of diagnosis is 3 years. But we all know that 85% of the brain growth happens by 2 years of age. That is why we are very vigilant to diagnose autism as early as possible. That is why now the earliest time where we can diagnose autism is probably 18 months. That means with the surety, we can tell by 18 months of age whether this child is autistic or not. So that is when the importance of red flag signs come, which we just dealt with. So if we pick up the red flag signs early, there are a separate set of red flag signs in autism, but if we pick it up early, we can reduce the average age of diagnosis and help in early treatment, because earlier the treatment, better is the outcome even in autism. So what are the characteristics? Like I just told you, 2S, correct? So decreased social behavior. So that means the child is using the very less amount of non-verbal behavior also. So when we talk to the child doesn't give us eye contact nor is socially interacting with us. So you go and talk to an autistic child, he just runs off to his room or runs off to his routineness. They like a routine. So if their routine gets disturbed, say they have change of place or change of routine, the smallest change of routine also can trigger hyperactivity in them and agitation in them. So they like sameness. They like sameness. They like the same routine that is there for them. Okay. So also they have very less amount of verbal as well as non-verbal communication. They lack seeking to share enjoyment. So the playing together with peer groups is hardly seen in autistic kids, and they don't like to play even sometimes with their parents. So sometimes, most of the time, they don't play with their parents. So they are lost in their own world. That is one of the commonest complaint with which parents come to us. So there is no showing or pointing. So generally, when you get a new kid, the child comes and shows the toy to everyone in the home. But such kind of behavior is not seen in a autistic child. Plus delayed verbal communication. So delayed verbal, delayed non-verbal, and they like sameness. So these are the main characteristics below 3 years of age. And once they cross 2 years, they start having the repetitive behaviors also. So these are the red flag signs specifically for autism. That is, they avoid eye contact. They give no response to their name by 1 year. They have limited non-verbal expressions. That means they avoid eye contact and are engrossed in their own work. They have no social interaction or play. They don't show any objects. There is no pointing, even as late as 18 months. There is no babbling. So verbal, non-verbal, both the communications are less, and they like stereotypic movements and stereotypic interests. That means they line up the objects, or a particular pattern of arrangement of the toys which shouldn't be disturbed. If disturbed, they get agitated again. So they have some routineness or some sameness in their activities. So this is commonly seen in autism. So how do we pick it up? Here also we have something called a screening test, and then we have diagnostic test. So you have to just remember few names. For early diagnosis of autism, we have active autism screening tool like MChat. So MChat is the modified checklist for autism in toddlers. Okay, so or pervasive developmental disorder screening test, PDSST 2. Okay, and social communication questionnaire. For children older than 4 years, we use social communication questionnaire. So younger than 4 years, we have MChat. You can just remember these names to be written in exams. Okay. So if the child is above 18 months, we can use these screening tools. If it is below 18 months, it usually goes by history. Again, history is very important. That is why we should know all our developmental milestones very well. Okay. If the child is positive in screening, or if the pediatrician has a doubt that it can be a positive autistic screening, then we do parental education. We do a comprehensive ASD evaluation by doing diagnostic test. We refer them early to intervention programs, and we know that the child has poor verbal and non-verbal communication. So the first thing to rule out is probably hearing problem. So we first do a hearing test, and then we follow this child very closely. So what are the diagnostic tests that are used in autism? So here also I just want you guys to remember the names. That is Incline Diagnostic Tool, or a Indian Scale for Assessment of Autism, ISA. ISA and Incline are the two important tools for diagnosis of autistic spectrum disorders. Incline is commonly used. Okay, these tests are used for detecting autism. Now, once we detect, what is the treatment? You should know autistic spectrum disorders can be controlled. There is nothing like cure for this. The child definitely improves a lot. We have seen very good improvement, but it is a lifelong process and lifelong condition to be dealt with. So what do? We tell them in the very beginning that it's a lifelong process and it requires a multidisciplinary team, but the improvement can be so well that the third person who is seeing the child may think that the child is normal. So that good therapies exist for autistic spectrum disorders. So the what are the therapies that we give? We know the problem is with the speech output. So 2S again. So speech and social communication and stereotypies. So to control stereotypies, we have medicine. But to control the social communication and behavior, we need therapies. For improving social communication and behavior, we have therapies. To control the stereotypic movements, we have medications. Okay, now what therapies do we give? We give speech and language therapy, where we teach the child how to talk. So this way, child learns verbal communication and also even non-verbal communication. Then we give special education to the child and even parental education, so that the child is very comfortable even at home. So generally what happens, whatever therapies are administered at the therapy centers, the same has to be mimicked even at home. So parent education becomes a very important limb of the treatment of autism. Then we have pharmacotherapy for comorbid condition, meaning, so autism associated with ADHD is very common. ADHD means attention deficit hyperactivity disorder. That means this ADHD child is never still. He's always banging on. He's always moving. He's always on a ride. And he's always anxious. The sleep, the amount of sleep the child also is very less. So very much hyperactive child is will be. So autism association with ADHD is as high as 70%. So in such situation, we should first treat the attention deficit and we should first treat the hyperactivity also. So for hyperactivity, we have few medicines. For attention deficits also, we have few medicines. And because sleep is very important for the child's growth, we have medications for letting the child sleep well, like melatonin. So if the child has sleep problems, there is sleep disorders, then we also give melatonin. So at the same time, attention deficit and hyperactivity medicines also help in reducing the stereotypic movements. So these are the pharmacotherapy that we use for the second S or the comorbid condition. So what are those? So these are the most commonly used medications. So antipsychotics are used for aggressive behaviors, repetitive behaviors, and anxiety problems. Methylphenidate is used for hyperactivity disorders in ADHD. Okay, alpha-2 agonist like clonidine, atomoxetine also is used for hyperactivity disorders. And for sleep problems, we give melatonin, which helps the child sleep well. And we all know that sleep has a big role in synapses formation. That is why having a child who sleeps well is very important. Okay. Sometimes there is a certain role established in iron deficiency anemia also. So we all know that iron deficiency anemia not only causes anemia, but decreases the IQ of the child. Okay. Can anyone tell me how does it decrease the IQ of the child if you don't treat iron deficiency anemia? So generally it is because heme containing enzymes are also there. So heme containing enzymes which are there for major vital steps of cellular function. So that means if the child is iron deficient, even vital steps of cellular function are also affected, not just the oxygen carrying capacity of the blood. So, and we all know that cells are having maximal function, including the neurons, till 2 years of age. Till 2 years of age, the neurons grow and they have a lot of synapses formation, myelination, all of that thing. So, because of this, the CNS development also can get hampered, leading to decreased IQ in future. So that is why it is fair enough to treat all the autistic and ADHD kids even with iron supplements if they are found to be iron deficient. Okay. So this is also one part of the pharmacotherapy that autistic kids take. Okay. So this is about shortly about how autism has to be screened, diagnosed, and treated. Okay. Now I just wanted you guys to think a lot here. I think so. Let me tell this. A 10-month-old child has come. Child cannot roll over. So rollover should be achieved by 4 months, correct? 4 or 5 months the child should be able to achieve, but it has not achieved. But the child holds a pen in palmar grasp. So this is a little okay. Instead of having a mature pincer grasp, child has a palmar grasp. Child babbles and smiles to parents. That means the social component is probably normal. He cries to strangers. That means your stranger anxiety is also normal. So that means your social milestone is normal. Language milestone is probably normal. Fine motor is nearly equal, but there is a gross problem in gross motor milestone. So what do you think is the differential diagnosis here? So it's a gross motor delay. What will you think here? Okay. Yeah. Got it. Yeah. Okay. Okay. Fine. Okay. So yeah. Yeah. Thank you. Thank you. So you know that you are dealing with the gross motor delay. So what do you think can be a diagnosis? You can drop down in your comments. So probably you're dealing with some muscle problem, correct? So it is probably a neuromuscular junction issue because of which the child doesn't have child has a problem in gross motor milestone. That means either your major muscles has a problem, or there's a problem in the synapse that is there, or very rarely it can even be your upper motor neuron problems, because of which the higher mental functions can be impaired. But in this case, probably looks more like a myopathy. It looks more like a myopathy. Okay. So this is one example that I'm dealing with. Next, coming to a child who is 3 months old with no head holding. So generally by 3 months, you should have at least partial head holding. This has zero head holding. But there's one thing which is very striking. The head circumference is 46 centimeters. So it is definitely abnormal. Can you drop in comments what can be the cause here? So probably we are dealing with the case of hydrocephalus. Now if the head is big, definitely the child will not be able to have neck control. So don't be in a fixed mindset that every loss of head control is a muscle problem. It can be a other problem like hydrocephalus also. Okay. So one last example. So here, this is a real case actually. We got a newborn who came to us at 3rd week of life with excessive crying. So the only complaint that the parent had was child continuously cries. We give feed only for an hour, he's fine. Then he continuously cries. So we tried to rule out every possible causes like probably a pain, probably fever, a colicky pain. All of this was ruled out, but we did not get any answer. All of this was normal. So a child who has excessive cry without any organic cause probably has hearing or vision problem. Why so? Because child craves for a sensory input. So when there is no sensory input, the child is not able to see, or the child is blind, or if child is deaf, automatically the only way the child can stimulate himself is probably by crying, and he wants to be held, and that's the only sensory stimulus he gets. So if you don't find a organic cause for excessive cry, you have to keep this in mind that it can be a problem in vision or hearing. Okay, so the carry home message after 3 classes of development is you should know all the developmental milestones. Hearing and vision shouldn't be missed. A red flag sign is one thing that all of you guys should know, and you should know when to refer the child to a child developmental unit, and you should know what is autism, how do we screen for autism, how do we diagnose it, and generally treatment is multidisciplinary. It can be a pharmacotherapy or just behavioral therapies that we give for the child. So today's was a short class. So I stop it here. You guys can let me know if you have any doubts. Okay. Yeah, sure. So if you have any doubts, you can always mail me at my mail ID. I've kept it on the first slide. So you can always mail me on Instagram or YouTube, or my mail ID, that is laxmikamath02@gmail.com. You can also message me on my WhatsApp number, that is 7795 So that's all for today. We have covered two major things, that is nutrition, the growth and development. Next class, we'll see for the next professional competency that you guys have, and we'll go accordingly. So that's all for today, guys. Thank you. Thank you. Yes. Yes. Thank you. Thank you. Sure. Bye.